Council to welcome our phenomenal PDs from fantastic programs from across the country tonight. But before we get started on that, I just wanted to mention Future Neos Now has a lot of great upcoming events and different initiatives to look forward to in July. We are launching our health equity curriculum roadmap this upcoming summer, which will be an opportunity to learn more about neonatal health equity topics as a 3-year curriculum. If anyone's interested in signing up for that, to look out for those emails. We're also going to be launching some social media reels to talk about landmark research articles from a book that I think all of you should consider looking into called 50 Studies Every Neonatologist Should Know. We're going to try to break down those topics into simple 1-minute videos. And last but not least, we're also launching our podcast called Neo Talks from NICU learners to leaders. And our first podcast is going to be about hemodynamics. So we will be launching that this summer as well. So a lot of fun things to look forward to this summer. But without further ado, let's get started on the main event of the night. And I'll pass it along to Anjana to talk further about that.
Hi everyone, my name's Anjana and I'm the chair-elect of Future Neos Now. Before we start, I just kind of wanted to go over the format of what the webinar will be like today. We'll begin by addressing some of the questions that were submitted by audience members and also some commonly asked questions about the fellowship application process. And then during the last 15 minutes, we're going to open the room up to the audience for a live Q&A where you'll have the opportunity to ask any additional questions that you have. And as you might have already received the notification, we'll be recording this webinar and we'll post it on our YouTube channel for anyone who wants to go back and look at it, or for any of your colleagues who weren't able to attend today. So I'm going to hand it off to one of our executive council members, Megan, to continue.
Alrighty. One moment here so I get the slides up and going in the right format. Alrighty, I have the honor of introducing our first 3 panelists, and we're so excited and grateful to have them here tonight and sharing their insights. First, we have Dr. Ala Satseva. She is currently the program director at Cohen Children's Hospital, and she has been involved in GME for the past decade, first as an APD and then it stepped into the PD role at Cohen Children's, which is a moderate to large-sized urban-sized fellowship program. Her academic interests include medical education with a particular emphasis on procedural skill acquisition, competency development, and use of simulation-based training to enhance learner performance and patient outcomes. Our second panelist is Dr. Melissa Scala. She is the program director at Stanford University slash Lucile Packard Children's Hospital. She has been the program director there since 2018 after serving as an APD for 2 years. She is also a member of ONTPD, which is an executive council for NICU Fellowship Program Directors, and she's currently the co-chair of this committee. Her interests include proposed training to the American Board of Pediatrics for NICU training. And then third, we have Dr. Nicole Dias. She is the APD at University of Colorado School of Medicine. She has recently served as the education chair for TCAN from 2022 to 2024, and she also is currently on the executive council for ONTPD. One of her roles is director of the residents and fellows as educators elective and co-director of the School of Medicine's education track, where she works on developing curriculum surrounding educator professional development and studies educator identity formation. One of her passions is medical education, and she partakes in the development of curriculum for neonatology fellows across the country, as well as in educational advocacy initiatives.
Victoria, I think you're
Sorry,
muted.
I didn't realize I was muted. I'm Victoria Palacios. I'm a second year, going to be third year at Stanford, and on the panel here as resident liaison. And I'll be introducing our next three speakers. We also have Dr. Rachel Greenberg. She is program director at Duke University and has been there since 2022 as their program director. Her research focuses on improving safety and efficacy of drugs for infants and children. Um, and she also serves as a PI at Northern Carolina Clinical Center for Neonatal Network. All right. Our next slide. Sorry, I don't have control. Next we have Dr. Bruno. She is the an associate professor of pediatrics and the program director for Yale School of Medicine. She is in her seventh year as program director and is also a member of the ONTPD and has been since 2025. Her work primarily is in the clinical procedural and resuscitation training research space, and also has a passion for improving training competency and patient safety. And then we also have Kristen Melton, Dr. Kristen Melton here. She is our associate program director and the previous program director at Cincinnati. She has been there for 20 years and is also the medical co-director for a level 4 NICU at CCHMC, where she cares for very complex congenital disorders. And those are all of our amazing panelists here today.
Alrighty, so to start us off tonight, we have our first question for Dr. Scala and Dr. Dias. And that question is, how can applicants best assess program culture and fit during the interview process?
I don't know which one of you, how you want us to go in order. I think this is a great question. I think it was much easier to get a feel for a place back when we were in person. And I think we lost something when we went to the Zoom platform. I mean, I think it was great for financial reasons because all that traveling about was super expensive. And, for all the big money that you make in residency from those sweet residency salaries, like you don't really have extra to spend. But I'd say the best way is to talk to the fellows. All programs should have some sort of session where you get to talk to the fellows alone without the pesky program directors listening in. And so take advantage of that. Ask them very direct questions. And most good places will also, share fellow emails with you and they can communicate with you after the day. And of course, if you know anybody at the program, that's great intel, right? To sort of network and talk to them either at meetings or through friends or whatever. And other than that, I would just look for places that have program leadership that is transparent and seems super committed to their trainees. And ask the fellows about that because I think that's a vital piece of feeling supported during what is a really challenging period of time, fellowship. So I don't know, Nicole, what are your thoughts on this?
Yeah, I completely agree. I cannot emphasize enough the importance of getting to meet the fellows during your interview day, especially if there's some sort of, meet or greet and lunch where you can get a group of fellows. Take notice of how they interact with one another. Do they seem to know and like one another? I will say a caveat here, if there is only one or two fellows in there, like ask about that specifically before jumping to conclusions, as some of the interview days may fall on dates where fellows may be away at conferences or on parental leave or on vacation. Um, and, outside of the fellows interaction, how do the program directors and coordinators interact with one another? I think some specific questions that get to culture are things like, how would you describe your relationship with your co-fellows, faculty, program leadership? Ask about specific situations that are important to you. I think other buckets of questions are in regards to, can you give me an example of a recent concern raised by a fellow or by the fellows, and how did program leadership or the program react to these concerns? What were some of the changes implemented? How is feedback provided throughout your training program? And I would say, in general, don't be afraid to ask the same question of different people, as everyone has different perspectives and responses, in order to get a clearer idea via Zoom of what culture may be like. I think fit is a bit more difficult to answer than question, as it's so specific to each and every one of you. Completely agree with Melissa about, not being afraid to ask questions about the specific areas that are important to you. And I always tell this to all of my applicants, that you need to go somewhere where you're not only able to grow as a professional, but you need to go somewhere where you'll be able to continue to grow and prosper as a whole person. So ask about those questions as well.
Awesome. Thank you so much. Those insights are super helpful. We're going to kind of pivot and talk about signaling now. There was a lot of questions that we got through the registration form related to signaling, since this is a newer aspect to the fellowship application process. And our first question, we'll kick it off with Dr. Bruno, and that is, how do you interpret gold versus silver signals?
So this was new for us this year as well, right? In addition to the applicants, and there are, lots of different ways, and I learned a lot during the process too. What it can be used for is really to, decipher an applicant's interest in your program upfront, right? Um, the hard part is that some programs get, more applications than others, a significant more, a lot, based on areas of the country. And for programs, I definitely am aware of programs where it's used for screening for interviews, and I'm aware of a number of programs that actually use, if you haven't signaled, then signaling increases your likelihood of getting an interview, because we do get a lot of applicants who, at different places, and it really does help stratify, because a lot of the applications, when you go through them, and there are so many great applicants, and it can really be helpful. And so I'm aware of that, where that is it's utilized in that manner. I think it can be helpful for us as well. Obviously, when you interview somebody and you showcase your program, or there can applicants can become more interested, or potentially realize it's maybe not the right fit for them. But I've, that's been utilized, as well as the geographic preference. I actually find that helpful, especially being in the Northeast. We're not quite in Boston, we're not in New York, and we really, it was helpful for us this year, especially when they come out, the applications in the middle of the summer, in the midst of the summer, when it's like crunch time, and you have to make these decisions, arguably at one of the busiest times of the year for families. for families and new onboarding your fellows. So that's really what it's on our initial interest. And now that being said, if an applicant doesn't have an initial interest in the program and then they recognize afterwards that they might be, that doesn't stop us from really looking or other programs I'm aware of if there is an interest follow-up. Emails are important, knowing the program and so it's more than that, but it's definitely helpful for a number of programs that I'm aware of for screening processes.
Awesome. Thank you so much. And Dr. Greenberg, we would love to have you weigh in on this question as well.
Sure. Yeah, I think as Dr. Bruno mentioned, we are still learning and how to interpret these, and at least you'll get a sense of how a couple people are thinking through these by these questions today. I think when I think about gold versus silver, it's more of and it sounds like that's what this question is getting at. Is there a distinction? I think it might depend a little bit on the program, is my suspicion. If you're a program that tends to get a lot of signals, then maybe that gold versus silver is a nice distinction to even differentiate among the signals. If the signaling is not as prevalent in your application pool, then whether it's gold or silver, it probably is not as, it still is showing that the applicant has a bit of and a baseline interest in that program, whether it be because of geographical location or because of where some other nature of the program or there's the program setting or the size. So I don't know. I think gold versus silver is just a little bit. If you get as a program, I'm getting someone. I see an applicant who has a gold signal. That to me says baseline. My program is maybe in those top three that they're thinking about initially. Versus you have the 5 silver ones as well. So, but that doesn't necessarily, I think our program wouldn't not select someone for interview because they haven't signaled for sure. Because we know that lots of things can change in the process, and I think and I suspect also that some applicants are using signals in different ways, and trying to communicate to certain programs. So, thanks for the opportunity to weigh in.
Of course. Thank you so much for your thoughts on that. And our next question touches on a similar thought, but is slightly different. And we'll start it off with Dr. Melton, and that is, how does signaling influence interview invitations?
Yeah, hey everybody. I really appreciate, I freeze. Sorry. I really appreciate the opportunity to answer questions today. So I think as has already been said by others, is that we're learning about signals as well. But I think that one thing that's important to understand is that the signals are meant to really support the applicants, right? Like they're really meant to be helpful to you as a way to express your interest in a program. But I think also it's important to understand that like it's not the end all be all, the only thing that people are using to choose interview applicants. So the one thing that I think is important for applicants to understand is that different programs are using these a little bit differently. So there are some programs that use this to screen to help them choose the applicants that they're going to interview. At our program, we use it to help understand applicants that like are really expressing an interest in our program. But I think most places do a holistic review. They're looking at you as a full applicant, and we interview applicants that haven't signaled to our program, as I think many programs do. So we want to encourage people to use them. I think it's to your advantage to express an interest, but we also understand that like you can't know everything about every single program, right? So don't think that if you don't signal to a program that you won't have the opportunity to interview there. I think that people are using them in a little bit different ways. But so just would encourage you to utilize them and do send signals to the programs that you consider as your top choice starting out. But it's just a way to express interest in what your initial impressions are about programs.
Awesome. Thank you so much. And Dr. Zayzatzia, we'd love to have you weigh in on this question as well.
Yes, I think I'm going to stick with the theme that this is new and we don't know yet on our side as a program directors how to use it. And we are very different in terms of what type of programs we are. When we speak with our NTPD group, they are definitely top tier programs who get tremendous amount of applications, and they are not sort of looking at it as strongly because they always get creme de la creme. There are programs who have challenges filling, so they interview everyone regardless of the signals. There are programs who are only game in town and maybe not as desirable area to live, so they will look at it specifically. I am one of 9 in the New York tri-state area, like if you look around, so there's a lot of competition. I can tell you that last year when we looked, our committee approached it because we do holistic approach, we blinded ourselves initially to the signals to see who we selected, and then we looked back to the signaling. And it did turn out that everyone who gave us gold signal, vast majority of silver was selected anyway, who were interested. And then we went back to those who were not gave us silver signals and were not initially selected and compared them to similar quality of applicants, and that sort of was an edge potentially to give them interview over the other or put them high on the waiting list, et cetera, et cetera. But after that initial approach, we did not look at the signaling after the interviews, after ranking, and again, only PD and APD saw the signals, nobody else on the committee. And I know the residencies, especially who have a lot of signaling, like Gen Derm or surgery, they have all these strategies of how to play the game. I just want to be very clear, there's no game to play. We all figuring it out. This is sort of, there's no way to game the system and make it your higher chances. It's sort of, we as a program directors take it at face value, whatever the signal you give us.
Awesome. Thank you so much. And Dr. Zatzia, you kind of touched on this already, but our final question related to signaling is, does signaling continue to influence applicant ranking after interviews? And we'd love to have Dr. Scala and then Dr. Dias weigh in on this question.
Nicole, you want to go first this time?
You can go ahead, Melissa, and then I'll go.
Okay. No, basically. So, I mean, the idea of signaling is that before you know anything about a program, you sort of like make your best guess at where you might want to go. But then we know that once you come to interview and we, give you all the information about the program and you get to meet the fellows and you get to check the fit and all that stuff, like we talked about before, you're going to change your mind. And so we don't consider signals relevant anymore after you come to visit with us. I will stress what other people have said. There is a wide range of approaches to signals. There are programs who are only offering interviews to those who have signaled them. So I would say 100% use them and make your best guess. We did not do it that way. We did it more like others on this call have done, where we do a holistic review. We make our list how we want to make it based on who we like to interview. And then we looked only after the fact to sort of see if there was something that would tip somebody over into the yes pile. Basically, all it did was help you get into the yes, I'm going to interview you pile if you signaled us. So that's just how we did it. But I know there is a range, and it's going to be hard to tell from the outside how they are approaching it. But once you come to interview, we've said this in TPD, we've tried to spread the message, do not use signaling after you come to do the interview.
Yeah, I completely agree. And that is, based on ERAS's best practice and their intended creation was for interview invitations and not subsequently. I think I'll add in a couple of words of continued caution here. ERAS has a lot of publicly available signaling data on their websites. They even have signaling data broken down by gold versus silver, chances to receive an interview, etc. I think it's very important to realize that in order for ERAS to have that data on the interview rates by signaling status, programs needed to have input their interview status of applicants into Thalamus and have sent out greater than 10 interview invitations. Last year, as you've heard, was the first time we all embarked on this journey of signaling. And I will tell you right now, not every program put all of their information into Thalamus. So that data, although interesting to look at, is not complete. There were large programs, small programs, middle-sized programs who did not input that data. So take that data with a grain of salt. Hopefully, some of this variability in how programs are utilizing signals goes down as we learn more, especially the best practices surrounding ERAS, such as not utilizing signals outside of the interview invitation and for rank lists. But I completely agree with my colleagues that signals were created to help you state your initial interest in all of the 9 programs, 11 programs that are out there for you to consider. So you should consider, use signals to all programs to which you are most interested in, including your home and away rotations. Applicants, all of you, should utilize the maximum allotted program signals per specialty because it can only help you. It does not hurt you in any way. And when signaling has been studied in other specialties who have used it longer, it has shown an increased chance of getting that interview in all of the specialties under which it has been studied. But we are new to the signaling game. And again, specific to this question, they are not intended to be used to influence applicant ranking after the interviews.
Awesome. Thank you all so much for weighing in on signaling. I know it's a big topic since it is so new on the applicant side of things too. And now I'm going to pivot over to Victoria to talk about research.
Perfect. Yes. So, starting off for research, our question for the panelist is, how should applicants who are still exploring potential research interests discuss them during interview season? So generally just with discussing research on the trail and future goals. And we can start with Dr. Greenberg.
Hey, thank you. I think how I would interpret this question is, as opposed to some applicants who may have really solidified their research interests and know exactly what to talk about, versus this question is about who are those applicants who are still exploring because they haven't really decided on a thing yet and how to approach that during interviews. So the way I really love applicants I love applicants who have are really passionate about something and know what they want to do. But I also love applicants who are still exploring, because I think there is a lot of benefit into having some flexibility in your research or scholarly interests, because how successful you are going to be is often very dependent on the mentorship that you have and how your interest might fit with a mentor. And so some of the best projects that I've seen coming out of fellows are they didn't really know what they wanted to do until they arrived, and then suddenly their interest is piqued by something, and they have this great mentor who just takes them in a direction that really can honestly launch their career and where they're going in the future. So that we've seen a lot of applicants and fellows be successful in that way. So if you are someone who is still exploring potential research interests, it's okay and actually really great. I think it's important that you can talk about like some potential interests that you have, talk about scholarship. It's not always what we think about as, heavy basic science or clinical research. It might be QI, it might be advocacy, it might be education focused. Talk about what's exciting to you, and have some thoughts about what you might want to explore. If you've done your homework and looked at the program and know what some of the people in the program, what some of the faculty are exploring, and those are interesting to you, I think that it's really nice to have looked at that and be able to ask questions about those people, or even ask to meet those people during your interview day. Even if you're still exploring, if you have an experience of doing a project, it's great to hear about those as well, to show to really show your curiosity, to demonstrate your work ethic, that, even if maybe you're still exploring what you want to do in fellowship, here are 2 or 3 things that you've accomplished thus far, and what was it like, and how were you able to accomplish that? I think those are really good conversations during interviews. So whatever it is that you dive into deeply, I think talking about that is important. But it is fine to still have a lot of options on the table at this point in your career. I think that's a lot of what fellowship is for, to really solidify those professional interests and goals.
Yes, I would concur with everything that Dr. Greenberg just said, but it is actually quite rare to see an applicant who has a very clear idea what they want to do, how they want to structure their career. Usually it's like MD, PhD type, but most of the people are still exploring, and the residencies are definitely not built for a strong research experience and very robust one. So we all know that, and very often you do project that is just available, not necessarily fits your strong interest. There's definitely educational value from the project, but you might want to pivot into something completely different. It is always good to have an idea of at least what area you would like to explore, if not necessarily a question, but sort of like what it is you want to focus. And it is important for the applicants to really move away from idea that scholar activity is all translational bench type of research. This is a lot of variability, and med ed is gaining a lot of popularity. So is like simulation education and curriculum building, etc. QI has always been for the last couple of years. So there's a lot of opportunities for you to figure out how to build your scholar activity and then use it as your niche, and how to build your career from the get-go. So if you have a couple of areas of interest, be open about it. Make sure you do your research about the program to see if they can support those interests. And very often, even if you don't meet that person during the interview day, we will be happy to connect you offsite separately, and you guys can have interaction with a mentor and talk about potential interests, and this way to help you figure out how to build that question, and would that person be a good mentor in this institution or not. So it's fine to be undecided, undeclared sort of major, but it is good to be open and definitely do your research to see what the program has. And you do want the program has a lot of variability, that not everybody's doing the same thing.
Perfect. Yeah. Thank you so much for both of those insights. I think we're going to pivot from research now. We'll go to more of diversity, equity, and inclusion questions. Starting with our first question, is what distinguishes a program with a strong culture of diversity, equity, and inclusion? And the panelists, will start with Dr. Dias, and then Dr. Bruno will also be answering.
Excellent. Thank you so much for this question. I think in regards to distinguishing a program here, it's all about how people at the individual programs answer questions surrounding DEI. Ask about particular activities and professional development as it pertains to DEI that fellows and faculty engage in. How frequent are these activities? does the person you're asking this question of, do they struggle to answer the question, or are they readily have an answer to that question? I think that speaks volumes to the culture of DEI at their institution. I think in addition to questions, doing a deep dive into their website, not only their fellowship website, but their institutional website as well, to look for what activities are available to trainees, to faculty through this lens. Do you have a difficult time finding those activities? That all can speak volumes in regards to this question. I'll throw a resource into the chat as it pertains to this question. It is a video surrounding the job search in neonatology, but I think a lot of the advice as it pertains to DEI and how to get a sense of the culture surrounding DEI still plays to this day. So yes, it's about the job search, but I think the pearls away from this video are still applicable to everyone in this room.
Wonderful. Thank you so much. And then Dr. Bruno, do you have anything to add?
Sure, to echo what Dr. Dias was saying a bit, the items, so beyond the website and talking to people, the items shared. So different fellowship programs have different ways of getting an applicant ready for the interview day. We end up sending out attachments, a file that has what's highlighted in our program, the activities that our fellows engage in, and the different councils, like there's diversity councils, there's Office of Collaborative Excellence. So those things, and the culture of it is what activities take place amongst all the pediatric fellowships at our institution, and then amongst our own fellows. And then the discussions with the fellows, I think there's nothing like talking to the fellows themselves, and getting a feel for the faculty who interview you and ask those questions, and see how they're answered, and see if there's what kind of pauses there are, what kind of information is volunteered. And I think that's very helpful. And then just the connections beyond, outside of the interview day. Sometimes there's so much that you'll think of after the fact, or if you didn't ask this person or somebody you didn't get to meet that day, reaching out. I always welcome if applicants really want to know more about the program as far as other activities, it really connecting with others where you can get what you can't feel in person, like Dr. Scala talked about in the beginning, that what you can't get from that feeling being in person, as best you can outside. So putting if you don't get it from the interview day, or you don't get that feeling, you want more of a feeling of the culture, just really reaching out. So that's the gist of what I have to say for that.
Perfect. Thank you so much. And we have one more question along the same lines. And it is, what advice do you have for applicants who require visa sponsorship, and how are programs working to support them amid ongoing changes in immigration policies?
I think what I would say here is that this is an ever evolving answer to this question. As a program leader at my institution, I feel like every month I get a new update of where we are, what's up, here are all the resources. Just kidding, here are new resources. And so questions or answers that you get from certain programs may change over time. I also think this question is very institutionally dependent in regards to what resources exist and how their institution is guiding individual programs in visa sponsorship. I think that being said, last time our organization of program directors tried to poll the room, the great majority of programs were still offering and reviewing applications of visa candidates. There may be some differences in regards to different visa statuses that may impact application review. And so I think my biggest advice would be that for your top programs, curate that list with a mentor, with whoever is at your institution, be it your mentor or be it the visa, office, who's helping you navigate this process. Curate that list, and then send some communication to program leaders at those institutions if it's not your internal institution, to inquire about how um, that institution is what are the waters seem like at that institution that you are unaware of, as it's an external institution, in regards to visa status and visa sponsorship. I don't know, Dr. Bruno, do you have any further advice there?
So yeah, to your point, Nicole, the our GME office really tries to keep us as updated as possible with the ever-changing climate of things. We have and are continue to, and I know many programs are dedicated to try to get the best applicants and the best fits for our program, regardless of whether you're on a visa or not. And the nuances to it certainly can be a little bit challenging as far as what type of visa, and that's again ever changing. But that hasn't changed what we do as far as interested, excellent applicants who communicate with us their interest, and we really try to make it happen as much as possible. So you're putting some more, Dr. Dias is putting more resources in there. It can be actually quite I know it can be quite a stressful process in general anyway, even for some of our faculty, and then some of our fellows who are graduating with visas. We've pretty much had at least one person with a visa most years. So that we're committed to, and I know most programs are committed to try to continue to recruit those applicants.
Thank you so much both for those answers. So I'm looking at the clock and I know we have just a few more minutes before we open up to a question and answer panel. So before that happens, we have one more question about post-interview communication for Dr. Scala and Dr. Melton. What role, if any, do post-interview communications and participation with programs, events play in the ranking decisions?
I guess I'll go first again. It doesn't really play much of a role for me. In part because I don't trust them. I've had people email me in the past when I was new at this and said, "You're my first choice in all of this," and how it turned out, they should have matched with us. Not that I can't remember how much I took it into account back then, but people are not truthful, which is really terrible. But it has made me realize that. So I don't really pay much attention to them. I mean, it's nice if you know where you want to go, feel free to do it. It's not bad to do. Don't lie, because I would say our community is not very large. And you think it's big, but it's not. And so people will remember if you have said that you want to go there and then they rank you and then you don't go. So please don't do that. I think it's been interesting because people will send like thank you notes after the interview day and things like that. And then I've heard from applicants later that they were then upset that the faculty member didn't then gush back to them. The faculty are very busy, and so it's not, I would say don't expect a lot of back and forth with faculty. If it's a possible mentor, then and you're trying to set up, time to talk about your research and stuff like that. I think that's a different situation, but don't get your feelings hurt or think people are being rude if they don't also respond back. So if you want to send something, great. I'm not really gonna take it into account much. And I, I really, we are going to go on your application, on your interview, on all your letters and all of that, rather than whatever you email me. So, but other people may have other approaches.
Yeah, it's Kristen. I would say that it is helpful though that if I think as somebody else mentioned, like if there's somebody who you heard about during your interview day that you want to meet that you didn't get to meet, then like reaching out to say, hey, I would really love to meet this person. That's the nice part of doing Zoom interviews, right? Is that if you didn't get to get something in your interview day, it can be set up outside of that in many programs. Talking to a fellow that has similar interests as you to get a sense of culture and fit, like that's a great way to kind of take advantage of the system as it's set up. So we do like to hear people, they heard something that's really interesting to them or intriguing to them. I think that is helpful. I do think, as Dr. Scala was saying, like, be transparent, be honest in that communication. Don't just send out emails to every program and say, I'm ranking you first, right? Like, I think you're going to interact with all of the neonatologists in the future. And so that kind of communication matters. But I do think sometimes people feel like they can't express their interest in their top choice, and you can. You can send an email and say, I really loved your program and am going to be ranking you number one. That's honest and transparent and allowed. And but I would echo that you shouldn't expect that you're going to get communication back, because I think the programs especially want to be careful about honest communication, and make sure that they're not being misleading in any way. And so generally you might not hear communication back, or you might hear just a thank you for expressing your interest. We really appreciate your interest in our program. But so I think that doesn't influence ranking decisions, but can be something that you can really use to your advantage. And then for places that do offer a second look where you can go to the program, those are really meant to be after the rank lists are made by the program. They shouldn't be influencing decision making by the program itself, but it's really meant for those programs that can offer that. It's really meant to be able to give you an idea of what does the institution look like, have some time to interact with the fellows. So some places are able to offer second looks, but that's really meant to be done after the ranking decisions are already made.
Yeah, I'll add one more thing, which is, anything that happens post, I think should be an exploration of how you feel like for fit for you, not so much for me. So like I absolutely agree. Talk to the fellows, talk to the mentors to see if it's for you. Unless you do something really strange that gets back to me, it won't affect your your application. Um, but but I do support that. Some programs send love notes to their top people, like their favorite rank list folks. We don't. So you what you shouldn't do is also take that as an indication of anything, because some programs do that and some don't. And so if you don't get a love note from me, you could still be my number one and it won't matter. Okay. So you got to really go by how you felt about the program after you analyzed it. Just so like if this is like reading tea leaves of post-interview communication to try to like figure out the best game for that for your rank list, I think it's a little challenging.
Thank you so much, both of you. So that will close out our formal like questions that we had sent in that we had gone through and decided, and now we'll open it up to the floor and anyone to drop questions in the chat or talk directly. If we get a lot of questions in the chat, and it takes more than 10 minutes, we can always send out these questions and have them answered later. For the panelists that are willing to take the time to answer them. So we'll get started. I saw one was already dropped. in the chat, so we can start there. They are asking, does completing a fellowship from a very new program affect job opportunities afterwards, especially in the case of having a visa?
I think it depends on what type of a job you're looking for. So there are definitely most of the places will look at the applicant rather than the reputation of the institutions that they're finishing graduating. So if you are fitting what they're looking for, because new attending is a big investment for a program. So if you fit in what they're looking for, what they need, what holes they need to fill in, what niche you're offering, does not necessarily matter. But there are definitely variations between the programs.
Okay, thank you so much. We got a few more. One of Rachel is asking, what are the thoughts on submitting 3 versus 4 letters of recommendation?
I can start there. I think it really depends on your letters. I think absolutely you need a letter from someone in the NICU. And I know that seems silly, but every once in a while I get an application with no NICU letters of recommendation, and then you're left thinking, but why? Why is there not a letter from a NICU experience? And so I think this question is could be very specific to you as an applicant. I would also ask this of your mentor. In thinking about that fourth letter, is it going to add to the letters that you already have? Or is that fourth letter for example, if a resident rotates for 2 weeks in the NICU, they have 2 attendings, you may risk having 2 very similar letters from both those attendings. And so can you think about strategies of how to curate your letter writers, so that they write about different aspects of you and your application? I think is the best advice that I can give there. I don't know if anyone else has other comments for that question.
I will just say that I don't count the number of letters that in an application when I'm screening, but I do read them, and it is about the quality more than the quantity. But there are I can definitely see situations where there is the opportunity for that one additional person to provide a perspective that wasn't provided. So I think it really, there's no right answer here, as long as you do have the NICU one. I think that's the biggest thing.
And I would just say it really does matter how well that people know you, right? So choose people who know you well, that you really have had a lot of interaction with. And so, and I think what Nicole was saying, you can, share information with them. What are your interests? What are the awards you've gotten? Ask them to really speak to the things that they know about you, because that's what's helpful to us, is the letters that really speak to what they know about you, how they've interacted with you in whatever context you've worked with them in. So it really is important to have a neonatology letter, but having letters from people who've had really close interactions with you is super helpful to have a great letter.
Perfect. Thank you so much. Our next questions both kind of go with the personal statement. So we'll combine them and use it maybe as our last question this session. If there are any more, just to be respectful of everyone's time, then we can try to send them out and get some answers on an email thread. So the question is, what makes a strong personal statement? Like what are you looking for in a good personal statement? And then also doing custom personal statements for programs that applicants are very.
I will say that we have had conversations at ONTPD about getting rid of the personal statement. And that is because increasingly they sound the same. I think there's a lot of use of AI in generating these. And there's a lot of people sort of write the same thing, which is both, it doesn't detract from the truth of that, but it doesn't help us distinguish between candidates. So a lot of people write about an experience they had in the NICU, which got them interested in neonatology. So be it like a micro preemie delivery or resuscitation that was impactful or something. And and it's not that's not important to how you got here, but it doesn't really help us as a program to understand you, right? There's nothing sort of unique about that that tells me about you as a person or what you want to do with your career or with your life or what your values are. And so the more real you can be, while also being professional, like, I think that is helpful. Or if you have something unique to say or something to explain, it's an opportunity to do that. But we honestly we may get rid of it in the next few years and go to some other standardized questions based on qualities that we think are important as a neonatologist. So look for that, because of where it's sort of gotten that everyone is sort of talking about the same thing and it doesn't really get us anywhere, if that makes sense. I don't know if others have thoughts on this, but
I completely agree. I use that time to talk about what exactly within neonatology you're interested in or you could see yourself doing, right? Fellowship, yes, there's a huge clinical component to fellowship. There's also this huge scholarship component to fellowship, and that's the individualized part of scholarship. Just for example, I know some of you have heard me say this. Whenever you were little and your parents asked you what you wanted to be when you grew up, and you said astronaut, I highly doubt that your parents are calling you and complaining that you're going into neonatology instead of going and becoming an astronaut. But they asked you because they were interested to know what was catching your eye, what were you currently interested in, and that's the same thing I personally am looking for in a personal statement. What exactly within neonatology do I, as a program leader, have the resources to put them on that journey and get them there or not? So that's the part of the personal statement that I am most interested in. Love the other stories about the micropreemie and neonatology, but it's the usually the last paragraph that I'm like, but I want more. I want more about that.
I'm just looking at the time, but I do like when it's rare that they're personalized, but I do like when it does make it a little different when they speak about your program and they put the effort in to do that because a lot of them sound very similar. So that's my.
If you're applying to 30 million, please do not do 30 million personalized personal statements,
Yes,
right?
absolutely.
Think about which ones are
Agreed.
potentially your top. But I completely agree with Dr. Bruno.
And I know we're closing up, but just really quick too, is there anywhere you recommend doing that? Would you recommend it being kind of in the closing kind of paragraph?
I've seen it in different places. Again, it doesn't happen
It
that
doesn't,
often. So
just a few sentences showing
yeah,
interest.
just if you either at the top or the end, the top or the bottom of the closing.
Okay. Well, thank you everyone so much for coming. Thank you for being a part of this and to our amazing panelists. We're so lucky to have had such a great turnout and all six of you share your wisdom and advice. If we get a lot more questions, we'll let you guys know and try to get answers for everyone. But thank you so much for your time. It was really appreciated.